Welcome to Lynch's Pharmacy Film Studio. Today I'm going to talk about Distaclor tablets and suspension. So Distaclor is an antibiotic. It's a cephalosporin antibiotic. And why do you take Distaclor? Distaclor is a broad spectrum antibiotic, which means that it is active against a wide variety of bacteria. It is used to treat bacterial infections such as urinary tract infections, skin infections, chest infections, ear and sinusitis. It is suitable for adults and children and can be taken during pregnancy. Some people who are allergic to penicillin antibiotics may not be able to take Distaclor, so make sure your doctor knows if you have ever had an allergic reaction to any other antibiotic. Distaclor treats an infection by killing the bacteria that are causing it. So how to take Distaclor? If you're taking the capsules or liquid medicine, the usual dose for an adult is 250 to 500 milligrams 3 times a day. For a child, the dose is 62.5 milligrams to 250 milligrams 3 times a day, depending on the age of the child and his weight or her weight. Your doctor will tell you what dose is right for you or your child, and this information will be printed on the label of the pack to remind you. Your course of treatment may be for longer or shorter periods of time than mentioned here, so it is important that you take Distaclor exactly as your doctor tells you to. If you have been given the liquid medicine for children, read the directions carefully to make sure you measure out the correct amount of medicine. Distaclor capsules and liquid medicine can be taken either before or after food, although they may start to work sooner if they are taken before food. If you are taking Distaclor modified release tablets, you will be prescribed 1 or 2 tablets to take twice a day. Take the tablets with meals and swallow the tablets whole. Do not chew or break them up. Space your doses out evenly throughout the day. Keep taking the antibiotic until the course is finished, unless you are told to stop. Taking the full course is important, even if you feel your infection has cleared up, in order to prevent the infection from coming back. If you forget to take a dose, take one as soon as you remember. Try to take the correct number of doses each day, but do not take 2 doses at the same time to make up for a missed dose earlier. So, getting the most from your treatment. Some people develop thrush, which is a redness and itching of the mouth or vagina after taking a course of antibiotics. If you think you have thrush, speak with your doctor or pharmacist for advice. Some antacids may reduce the amount of Distaclor your body absorbs. Because of this, it is recommended that you do not take indigestion remedies during 2 hours before or during the 2 hours after you take Distaclor. If you are using oral combined hormone contraception, the pill, additional contraceptive precautions such as condoms are recommended for a time if you have vomiting or diarrhea, which lasts for more than 24 hours. If you need further advice about this, speak with your doctor or pharmacist. Distaclor may stop the oral typhoid vaccine from working. If you are having any vaccinations, make sure the person treating you knows that you are taking this medicine. So some of the main side effects of Distaclor tablets and suspension are diarrhea, nausea, vomiting and a skin rash. If you develop an itchy rash, swollen face or mouth, or have difficulty breathing, these can be signs that you are allergic to the antibiotic. Do not take any more of the antibiotic and speak with your doctor or go to your local accident and emergency department immediately. So you drink plenty of water to replace any lost fluids if the diarrhea continues, becomes severe or contains blood. Let your doctor know straight away. So in order to store the medicine correctly, first of all you keep all medicines out of reach and sight of children. Store the medicine in a cool, dry place away from direct heat and light. The liquid medicine should be stored in a refrigerator. It will have been made up by the pharmacy and last for 14 days. So check the expiry date on the bottle and do not use it after this date. Any unused medicine can be returned to the pharmacy for safe disposal. If you have any other questions, you can contact me through the live pharmacist on the website. You can email or ring or call in. Thank you.